Thank you. We're ready to start. You can dim the lights.
Oh, that's what she told me to do, though. She did. I think right here, she meant dim the lights. She did that right. Okay.
Welcome. Can you hear me? Yes. Okay, good. I know my husband always says I talk too loud anyway, so you probably hear me without the mic anyway. But I want to let you know that Dean Tooker was not able to be with us tonight. She's chair of Board of Trustees at Egger Home, and she really needed to be there for a very important meeting tonight, but she sends her greetings. And I should introduce myself for those of you who don't know me. I'm Dr. Kathleen Ahern. I am the director of the graduate nursing studies at Wagner College. And it's my pleasure now to introduce Dr. Nick Richardson, who is our provost.
Thank you, everyone. And congratulations to all the DNP recipients. It's just an amazing work you guys have done. I'm looking forward to hearing about the research you've all done. So I wanted to just welcome everyone to Wagner College. I'm Nick Richardson. I'm the provost here. I've been here for 22 years, formerly as a chemistry professor when I first started, but for the past 4 years I've been working in the administration. And I'm exceptionally proud of the nursing program at Wagner College. It is one of the absolute great programs we have. Our faculty is so dedicated and the students are just amazing. You can't go to any healthcare setting in this area without seeing and talking to a nurse from Wagner College, and they always do such amazing work. So I'm just really grateful to have been invited here tonight. We only have one doctoral program at Wagner College, and that's the highest degree we offer, and that's the DNP. There is no higher degree that can be obtained from Wagner College. And these 7 DNP recipients represent the absolute pinnacle of education from the School of Nursing and Wagner College. So I'd like to congratulate them for their hard work. And I want to thank you all for attending this evening. Thank you.
I thought I might tell you a little bit about how we actually ended up starting this Doctor of Nursing Practice program back, I guess it was shortly after Katrina. We know the disaster that was in this country. And at the time we were watching nationally what was happening as far as nurse practitioner education, clinical doctorates. And actually Dr. Paula Trapello and I decided that we should go ahead and start to begin the preparation for a Doctor of Nursing practice. And we looked at what had happened at that time as far as Katrina goes. And I know that some of you are well aware, because some of the all of you actually read 5 Days of Memorial about the doctors and the nurses, what they had to deal with during Katrina and the aftermath was heartbreaking. The decisions they could not make, and the skills that they really didn't have for that kind of disaster. So Paula and I decided if we do a DNP, we want to focus on that, because that should never happen again. And so we began to put together the different courses, look at the state requirements and all, and then we filed and we were able to get approval by the state of New York to run the program. And the courses that we put together are designed so that not only do these 7 graduates have the skills, the abilities to perform in a disaster, and also to deal with population health issues, but they also have the ability to make ethical decisions in a disaster, and decisions they can be comfortable with. And when I was trying to think of what I wanted to talk about tonight, and I've said to them, you know, you never go into a meeting without having a folder and you just throw some blank pages in it, and it looks like you really prepared a lot, so it's kind of a good thing. But I didn't do that tonight, because what I want to say is already right here in my heart to these seven. These seven individuals, I am so incredibly proud, and I know they hear that from everybody, but really how much you have accomplished. Many of the larger schools that have Doctor of Nursing practice, people do a group project. You know what group projects are like. Some people do more, some people do less, but every one of these did their own individual project, which you're going to hear about tonight. So that's one of the things that I'm so proud of. I feel you're walking out with the degree, and you'll come to commencement, and you will get hooded, and you will so deserve the degree. And the other thing, I'm just going to leave these little parting words to you, although we're not parting for a long time. We've been kind of joined at the hip for about a year here with these projects. And I'm sure they were saying, I can't believe she wants us to have more references. Is she never satisfied? But here we have the fruits of the labor tonight. So my students know that I'm a boater. I love the water. I love the ocean. And my dad used to have this really nice saying, which he borrowed from the literature. But it's, I wish you fair winds, calm seas, and a port in every storm. So be well.
Thank you, Dr. Ahern. On behalf of myself and the students, we'd like to present you with something. Hello and welcome. My name is Dr. Nancy Chorofsky. I'm the DNP coordinator. I'd like to please call each student up so that they can explain the project that you know that they've been so engrossed in for the past couple of years, because you've all been part of that journey with them. I'm going to start with a student. Her name is Idia Brown. She really developed this project. You have to understand these students were really engrossed in COVID. They started in 2019, and before we didn't even know what COVID was. And then in 2020, they were on Zoom, and we had to have commencement of our classes on Zoom. So this has been really difficult for so many of them, whether it was their home life, personal life, or their work life. And Idia found that in her work life, she works in a very big institution, that there was a communication issue. So she developed, her capstone project is improving staff satisfaction by implementing an in-house communication network, a quality improvement project, and what a wonderful project she did. So, and it is a project that not only improves patient health, but also something that she'll be able to build on in her career. So I'd like to welcome you.
Thank you. So, as Nancy was saying, the COVID created a lot of changes for everyone, day-to-day changes, change in policy, change in staffing, who's hired today, who's leaving tomorrow, who can come to work, who can't. And there was a lot of confusion, and I realized that with that confusion came a lot of dissatisfaction. So the project I chose was to improve communication as a means to improve the staff satisfaction. And we know the literature shows us that improved satisfaction creates a stronger bond to the organization that you're working with, creates less turnover and less burnout, and also makes the employee feel that they're part of the overall goal of the organization, and even impart their own feelings and their own ideas towards their work. So I created, together with the IT department, a communication network process, which is basically every time a new policy comes out from whichever department it is, it goes out to the entire center. The areas and the specifics of who it is directed to is highlighted, but the entire office knows, all locations know, all staff knows, despite their specific job title. and then they would get an email and a text message, and the text message would bring them to a link, and the link would show them the whole policy and also allow them to search previous policies, as well as has a bi-directional way, because we know that messages are important, but it's important that the message be received in the way that it's intended, and if there's confusion, that it should be able to come back. And after I did that, I used the CSQ, the Communication Satisfaction Questionnaire, and I did a pretest. I did a baseline survey, and then after I did the video and showed the staff how to use it, and once it was implemented, what the changes were. So we did see some significant changes, some not so many significant changes, but change is good in any direction. What was interesting, because I did a quality improvement study, was that you can continue to build on it. And it's already in use. We're already using this communication network. New policies go out, text messages back and forth, and the bi-directional communication. And communication is exceptionally important in any relationship and in anything we do. And I want to thank my colleagues here for always being available for the communication and for being available at any time when we needed to talk or to vent or to ask questions in the 11th hour of, oh my God, help me. So thank you very much.
The next student I'm going to speak about is Clare Brown. Clare also, her project is reflective of also the pandemic and the mental stress and anguish that she saw the nursing and medical staff go through. Clare's capstone project is entitled Increasing Knowledge Among Nurse Practitioner Students on Mental Wellness Through a Self-Care Educational Tool, basically showing nurses and how to recognize that areas of their job that are causing stress, and then that stress filters into their personal life and beyond, how to handle it and how to first care for themselves, and then they'll be able to care for their patients and others. So Claire, can you come up?
Hi. So as Nancy said, my project was about self-care strategies for stress and mental well-being. Mental well-being has been talked about a lot lately, more so than it has, I think, ever been in the past, and that's due to COVID. Nursing has always been a high-stress job. COVID brought that out, and these nurses were working in very, very unprecedented areas, really. And they will be continuing that. COVID isn't over yet. It will be here for a while, and then dealing with the aftermath of it is also going to be very stressful. So I thought it was very important for nurses to have some kind of a self-care tool that they could just use on the spur of a moment, very basic things that sometimes maybe we didn't always remember, about just taking a few minutes, take a breath, just go somewhere quiet and just breathe, walk around, walk out of the hospital, out of the unit, have that 5 minutes to yourself, then come back. In my educational tool, we spoke about journaling, which is another really good tool for releasing feelings and really looking into your own feelings and what you're dealing with. And when you see it on paper, it's sometimes easier to acknowledge it and let it go, which I think is important also. We also spoke about aromatherapy helping. You can keep, I mean, we all have our hand sanitizers everywhere now. So they have very nice aromatherapy hand sanitizers, which, you know, nurses can keep in their pocket, just take it out and spray it on your hands and give a nice whiff of lavender or citrus or something. Really helps to improve the mood and relax and calm people, which I think is really important, because as nurses, we know it's very stressful and difficult to do our jobs, and we have families to go home to. And it's sometimes hard to leave work at work and home at home. So it's really important to really take care of ourselves and really take that look inside of ourselves and take that time to take care of ourselves. So that was about my project, and the students I presented it to seemed to really enjoy it. We did a pre-test, post-test design, educational video was shown. It was received very well, and there was improvement on the post-test, but it did show that it needs to be ongoing education about how to take care of ourselves as nurses, because we're just so used to taking care of everybody else. So, and that's what I really wanted to try to get home to the students who I presented to, is that, you know, it's okay to take care of us. And all of you have taken care of me. And thank you for talking me off, you know, that we've all talked each other off that proverbial ledge many times over this, so thank you.
I'm sorry, I'm going to keep my mask on. Between my glasses, my mask, I feel like I can't hear, I can't see. I don't know which end is up. I'm sorry. The next student also, Christina DePhilips, is going to speak to you on a device that she herself was educated on by a nurse practitioner. Christina worked in a pulmonary unit during COVID, so she worked in a really active, ongoing COVID unit during the peak of March 2020. So she really had a lot on her plate in the middle of her education here. She was educated on this tool that she'll speak to you about. This tool actually, I really believe she's going to go further with this tool since so few people know about it, and we had such a shortage of oxygen during the pandemic that this tool alone not only gives patients the oxygen that they need at a lower flow meter, she'll explain, but it also saves oxygen. And you know, we don't know what the future is going to bring, with, which is now an endemic situation with COVID, but Christina has really now taken this education and this tool, and will continue to go on to educate others so that they're aware that this tool exists to save lives. So Christina, can you come up?
It's gone, Take it off.
So my research study was on something called the Nasal Oximizer Pendant. As Dr. Shirley had mentioned, I was working in the midst of the COVID pandemic, and we were just completely inundated with patients and completely lacking resources. We didn't know how to treat the patients fast enough, well enough. We didn't know what worked, what didn't work. And throughout my time at the bedside, I came across this nasal oximizer pendant, which is essentially looks like traditional nasal cannula tubing, but has a little bit more to it. Without getting into too much detail or it gets confusing. It basically helped us give patients more oxygen by giving them less oxygen, and essentially kept them off ventilators a little bit longer and helped, I think, with the survival rate. So I was introduced to this tool by a nurse practitioner. Most of my staff, my coworkers, had no idea what it was, including the ICU doctors, the intensivists. So I was intrigued when I first saw it, and I wanted to learn more about it. And at that time, I was simultaneously trying to come up with what I wanted to do my research project on. And I found a need for education on this tool. So this tool has been around since the 1980s, and we have nobody using it nowadays. So I created an educational tool, which was a video-based program for providers, healthcare personnel, really anyone, to learn a little bit about the tool and how it works and how you can administer oxygen effectively and what it can and cannot manage, one of which the conditions is COVID-19. And I did a pre-test, post-test study, and I utilized family nurse practitioner students at Wagner College. And I did find after they viewed the educational tool, they were much more well-versed on it, and there was some significant data that came from the study. So I think I am onto something with that. So I feel like the need for this is, as they said, continuous, and I would like to go further with it because I think the more we can get it out there and utilize, the better patient outcomes we can have, which is essentially what we want to do as doctorates, nurse practitioners, nurses, healthcare workers, and such. So that was how I came across my project and the results I found. And as all these ladies have said, I would be lost without all of you, particularly Dr. Eghern, Dr. Shirley, Dr. Turgeson. She's trying to recruit all of us because she loves us so much. But yeah, all these ladies, you know, going through a pandemic and learning the problems is really full circle of the disaster management. So I'm just grateful to have been part of the program and to have gotten all of you ladies, by my side. So thank you.
I just want to explain, on Christina's tool she was speaking about, it's actually a pendant. It almost looks like a necklace that you'd wear on your chest. And so this way the patient can move around and the patient can eat, put on makeup. And she enlisted Amanda in her movie to show practitioners what this Oximizer pendant is. So it's really cool, and I have no idea why it's not utilized more. It's that interesting and really improves patient oxygenation and health. So each of these students had not only to do their project, their paper, their research, their literature search, but they had to also learn how to do webinars, movies, conduct it themselves, which is not easy. That alone could take 75 to 100 hours just to learn that process, right, ladies? It was that part of it alone was, as I'm sure you all know, the work they put in was just an amazing feat. So the next student is Vanessa Kenny. Vanessa is our 1 student plus 2. She's pregnant with twins. We have been on this journey with Vanessa. So happy for her. Vanessa, prior to presently, worked in a very busy emergency department. Unfortunately, and she had to be dragged out because she didn't want to go on leave while she's awaiting the babies, but she was medically forced to. But she would still be in that emergency department up to the very last minute, knowing her. She saw the importance of education when a patient is discharged from the emergency room and how important the need for the education is, so there's no readmissions back into the emergency room within days or even weeks after the patient was discharged. So her project is on utilization, an educational tool, teaching undergraduate nursing students the importance of patient discharge teaching from the emergency department. So Vanessa, come on.
Hi everyone, good evening. As Dr. Shirofsky had mentioned, my focus of my DNP project was on teaching undergraduate nursing students at Wagner College the importance of discharge planning from the emergency department. I chose this topic because I've worked in the emergency department for most of my nursing career in different capacities. And I realized that a lot of the same patients kept coming back into the emergency department. And I found this really interesting, and I really wanted to know why this was happening and what was causing this. So as I researched this topic and I tried to understand more about what was happening and what could we do as nurses that could better improve this and to improve discharge planning to keep the patients out of the hospital, what could we do? So as I took a deeper dive into this, I realized that it was a lack of education on the nursing aspect. In regular nursing school curriculums, we do not learn how to properly discharge patients from the emergency department or from any unit in a hospital. So I felt that it was really important for nurses to really understand and gain this knowledge while they are in nursing school instead of just learning about it while they are on their floor working. So I created an educational program that taught the undergraduate nursing students how to properly discharge patients from the emergency department, and what are those key factors and indicators that we are looking for that we need to ensure that we instill in these patients before they go home and go back into the community. Because we want to make sure that they are understanding their plan of care when they return to the community to prevent them from being readmitted back into the hospital. So I created the educational program and I implemented it, and the nursing students viewed it, and I used the pre-test and post-test design method. And for the pre-test, the students had a basic knowledge and understanding of discharge planning, but after they viewed the educational video and took the post-test, it really showed increased knowledge of discharge planning. So I am looking to continue my research project because I would really like to implement this in nursing curriculums, so nurses are competent and confident in discharge planning before they reach their units. And that was my project.
Our next student is Nisha DePhilips. Nisha took on a topic of perinatal depression, which a lot has been researched throughout past even 20, 30 years. But that was more in women that were in heterosexual relationships. Nisha took on a very interesting topic and really delved into the topic of perinatal depression in lesbian mothers, and she did a fantastic job. So Nisha, please come and explain your project.
So I specialized in obstetric nursing for over the last 16 years, and I wanted to choose a topic that was familiar to me related to OB, but I wanted to choose a population that I wasn't familiar with. So when I started to do my literature review, I realized there was an increased incidence in perinatal depression in lesbian mothers. There was also a need for awareness and knowledge in FNP students to identify this. So what I did was I created an educational module on Powell that provided principles for perinatal depression and just awareness of the problem. And I created a pre-test and post-test for these students. And what was noticed was that there was an increase, there was a lack of knowledge in the students. So after the module was introduced, you saw that there was an increased knowledge in these students. So it was really important for me to do this because I was really unfamiliar with the population, just learning the new vocabulary. And what I hope to do is further this project in nursing curriculums. Hopefully, hospitals can utilize it just so more employees are aware that the lesbian population, they do feel invisible when becoming a mother, so that's important to me. I just wanted to thank a few people, and my husband for always encouraging me and supporting me to continue my education, but also to my girls, to Nadia and Layla. On those nights where I was really tired and I wanted to give up, your encouraging words of love and support is what drove me to finish. You supported me each day, never letting me lose hope, never letting me stop believing in myself. So I love you very much. And to these women, you guys are amazing. You inspire me every single day, the conversations that we've had since the first time that we met. And I look forward to hearing and reading about all of the work that we're all going to do together. So thank you again.
The next student is Amanda Powell. Amanda actually did another very interesting study on a bacteria known as listeriosis. Listeriosis is actually a very serious bacteria. It's one of the leading causes of deaths when people get food poisoning. And Amanda took on, her project was entitled Educational Program for Healthcare Providers to Increase Knowledge of Pregnancy Associated with Listeriosis in the Latinx Community. So Amanda, please come up.
So I initially stumbled upon this topic in Dr. Shirofsky's course. I believe it was 804, early on, when we had to pick a topic, disease, and discuss it, and do a paper on it. Well, I was shocked at what I found when I began investigating the topic of listeriosis. Listeriosis is a bacteria that's pervasive. It's present in soil, in food, on industrial equipment that cuts food, for example, cold cuts. And for a person with a great immune system, this may not present as an issue. However, certain groups such as pregnant women, elderly, fetuses, and newborns are at great risk for morbidity and mortality from acquiring this illness. Pregnant women are 10 times more likely to acquire listeriosis during pregnancy, and then I found that Hispanic women are 24 times more likely to acquire pregnancy-associated listeriosis. So this presents a significant issue for the community and nationally as well. The effects of a pregnant woman acquiring listeriosis during pregnancy are detrimental to the fetus. 85% of women who acquire listeriosis during the first trimester of pregnancy unfortunately end up with a spontaneous abortion. So this disease is very, very serious for this population, and because this specific demographic is plagued by this illness, and many people don't know about this, I thought it was essential to get the information out there to not only my peers, but basically to anyone I've spoken to in my family. I'm sure you've heard a wealth of information about this topic. My colleagues at work, I feel very passionate about this topic. So what I did was I created a pre-test, a 15-minute avatar-driven educational video, and then a post-test. And I included information about signs and symptoms, what is specific to this population as far as factors that may put this demographic at higher risk, such as barriers to care, literacy issues, and then one important factor that I found in my research was the pregnant women of the Latinx community, their identity crisis that they faced when trying to become acculturated into American society while keeping their identity as a Hispanic or a woman of the Latinx community. So as healthcare providers, I believe we're in an ideal position to mitigate this issue by facilitating trusting partnerships with this community. I did find statistical significance in my study, which I was very pleased to find, and I hope to not only translate this into a project or a study for healthcare providers, but I hope to get the information out there to the community that really needs this information, to the patients, to the population, to the public. So I really hope to do that with this work. And I want to thank Dr. Shirovsky, Dr. Richardson, Dr. Ahern, Dr. Tucker, who couldn't be here, Lynn Tyson, my family, my colleagues. You're all amazing, and I know we've all said it, but I really wouldn't be here without all of you, and I thank you so much from the bottom of my heart.
Our last student is Shirley Vincent. Shirley really, meeting her, Shirley actually and Nisha were two students that I had not known prior to them entering the DNP program. Many of the other students I had known because they had previously attended Wagner, many of them in undergrad, through graduate, and then doctorate. So, but when I met Shirley, I had a real connection with her because I have a lot of beliefs in lifestyle medicine and how your health really isn't a personal issue. You need to be personally responsible and have alternative treatments in addition to our medical model that we practice with. And Shirley really has really had a desire to really get the information out to other practitioners that lifestyle medicine is so important in health going forward in patients. And it really could not be more important than, like I said, during a pandemic that they just all studied through. Her project was entitled Teaching Provided Lifestyle Medicine to Decrease Healthcare Disparities and Promote Optimum Management of Affected Individuals with Diabetes Mellitus Type 2. Shirley, please come up.
All right, good evening, everybody. My topic is teaching providers lifestyle medicine to decrease healthcare disparities and promote optimum management of affected individuals with diabetes mellitus type 2. My children weren't able to be here. My daughter wanted to be part of the project, so she decided to help me and put this little collage that you see in front of you there, so I can remember, the actual components of the lifestyle medicine. Lifestyle medicine is a conventional and specialty medicine. Many people know to use lifestyle interventions with every condition that there is, but lifestyle medicine is actually actual primary modality that we can use to help treat diabetes and many other chronic conditions. but my focus was diabetes mellitus. And the components of the lifestyle medicine is whole food, plant-based diet, exercise, regular physical activity, restorative sleep, stress management, avoiding substances such as tobacco and alcohol, and also having positive social relationships. Those components are important, not individually, but collectively, being used all at the same time. We find that during COVID, the majority of the people that were affected were diabetics and other people with coronary artery disease, heart problems. And I find that a lot of those conditions could have been mitigated if lifestyle medicine was considered or taught to the patients. Many of the times, it's an afterthought when providing patients with information. With diabetics, they're usually provided with either insulin and medication, but then they're taught just follow the diet, but many people don't follow that. And that's why you find a lot of people going through those conditions. If there's a group therapy, like a support team of physical therapists, psychotherapists for people that are having problems at home that are not having good outcomes, if they're able to have those support and then a team approach that will follow long-term, then the patients will have better outcomes. The students that I did this presentation with the webinar, they were able to take this information and they were able to get a better outcome during the post-test when they understood that it's not just alternative medicine, but it's actually a conventional medicine and specialty medicine that they can use so that the patients can be able to follow and keep the regimen for diabetes. I want to thank my husband for supporting, the kids for supporting. My husband helped throughout with the kids, and I appreciated that so much during this time. It's not easy, especially everybody was just saying, going through a lot, through the pandemic and going through challenges, throughout, but we made it, and I thank God for it. I'm thankful to, Dr. Ahern, Dr. Sharovsky, and many of the staff. Going through names, I may start forgetting names. I want to also thank this team of lovely women. They're supportive, and that's been a great team, and I appreciate all of you, and I wish you all the best. Thank you.
Now I would like to call up the student class speaker. Her name is Nisha Phillips, and she's very reflective of all these 7 outstanding women. She's going to speak to her cohort. So Nisha.
Good evening, Dr. Ahern, Dr. Sharovsky, distinguished guests, nursing faculty, family, friends, and of course, to the guest of honor, the graduating DNP class of 2021. We made it. I'm honored and grateful to speak to you this evening. Fellow graduates, today is a defining moment in our lives. It is a momentous day. It is no secret or debate that we have proved ourselves to be one of the most resilient classes in Wagner College's history. We have truly earned it. We have given ourselves a gift, the gift of earning the highest practice degree in our fields. This gift allows us to be leaders, advocates, and initiators of change. We have the opportunity to make a difference in many ways. As I look back to the first day of Nursing 801 2.5 years ago, Dr. Gasselberg asked each one of us to introduce ourselves and to describe our nursing education, current work history, and our goals for the future. And I clearly remember Christina was one of the first students to speak as she proudly described her education, work history, and goals. As each student took their turn, I was impressed by each woman's level of leadership and expertise. I felt a sense of pride to be collaborating with a group of women who were accomplished, talented, and passionate about nursing. Their caliber of professionalism and competency was unmatched. We were dynamically different from each other, but we shared a common goal. We started this program to better ourselves, complete a terminal degree, make changes in nursing policy, and to help reshape healthcare. We have earned the titles that will go before and after our names. The road was not easy or smooth. However, each one of us worked fearlessly. We have successfully completed Dr. Stern's statistical final, wrote a minimum of 10 drafts to defend our proposal, created our educational modules on Powell or Render Forest, learned how to enter and read data on Intellectus, obtained 400 clinical hours, and in between writing papers, researching articles, working on our literature reviews, we also worked full-time jobs, maintained relationships with our families and spouses, and in some cases, raised children and even grandchildren. In March of 2020, our worlds changed. Due to the COVID-19 pandemic, we transitioned quickly from being on campus to remote learning. During those early stages of the pandemic, there was confusion, chaos, and uncertainty all around us, whether we were working in the hospital or clinic, teaching at the school, or just trying to get our families and children to adjust to a new world of lockdowns, social distancing, masks, and remote learning. It was refreshing to see my classmates and professors on Zoom every Wednesday night. Being in class helped my mind escape from the monotonous days of the initial lockdown. On Zoom, it was entertaining to see each other's families in the backgrounds of our classes. I looked forward to seeing Claire's grandchildren, Idia's children, and of course Vanessa's Valentino. We became more accustomed to one another and were able to find normalcy, hope, and a sense of security with each other. Our relationships also started to change. We began to lean on each other as no one really understood how much commitment and work we added to our already heavy workloads with this program. Even on our hardest days, Amanda and Shirley's calming personalities and words of encouragement soothed the stress to push forward to complete deadlines. One of the main things I've learned here is that in order to realize your potential, you have to act, always not being fully sure. So often we are presented with these magnificent challenges and opportunities that cause us to freeze up, either because we feel unprepared or ill-equipped for the challenges. It is important that we continue to challenge ourselves and take risks and sometimes leap without looking. Wherever your vocation takes you, the communities you serve will look for you to guidance. I encourage you to have faith in your abilities and seize opportunities. Wagner College has provided us with the training we need to help lead our post-pandemic future, which demands health equity and wellness across all populations. I humbly want to thank all the nursing faculty, especially Dr. Ahern and Dr. Shklovsky. We were given the opportunity to systemically translate the best current evidence into practice as we transformed simple PICO questions and disseminated into capstone projects. You provided us each with a strong foundation to build on and gave us the confidence to implement our projects for future practice. We would have never completed this program without your leadership, direction, and support. You established an environment that stands for integrity, inclusion, and excellence. This is not a concluding ceremony. This is not a farewell. This is a start. A new beginning. I look forward to hearing and reading about each of your successes and accomplishments as we take our careers to new and greater heights. I am fortunate to have met each one of you, and I wish you luck and success in all that you do. Once again, congratulations, class of 2021. So on behalf of the class, we just have a little token of our appreciation from the girls. Thank you so much for all of your gratitude. We have all your years of support and encouragement.
like them to stand for a picture after I give the certificate to them? Oh.
To
Right there.
your left.
To my left, okay, thank you. Okay. So now I would like to present each DNP graduate with their completion certificate. And I also have a little personal memento to give them. It's a DNP pin. The pin in the nursing practice goes back centuries ago when the monks were actually the nurses giving care to individuals. And it really came full circle during the time period of Florence Nightingale. So Florence Nightingale is our mother of nursing. She's our leader. We take from her all her research that she did in the bedside during the Crimean War. And the pin in a nursing profession is, it stands out. So I want to please not only give each student their completion certificate, but also give them a pin from me. So I hope you like it. So I hope I have it over here. So I give the wrong pin out. Yes, okay. So. I would like to first call Idia Brand, excuse me, to the podium.
Oh, stand here. Thank you.
The next student I'd like to call up to get their completion certificate and their pin is Clare Brown. No, take a photo. I'm sorry, just bear with me. The next student I'd like to call up for their certificate and pin is Christina DePhilips. The next student I'd like to call up for their completion certificate is Vanessa Kenny. The next student I'd like to call up for their certificate and their pin is Nisha Phillip. The next student I'd like to call up is Amanda Powell. Definitely not least, the last student I'd like to call up is Shirley Vincent. And in closing, I'd just like to say a few words to the students. I would like to congratulate all of you in the audience, that family members, friends that have really supported these students. I feel whether you're religious or spiritual, there really was a higher power that brought these 7 women together. I mean, when you obtain a DNP degree in the state of New York, you first have to have a family nurse practitioner degree. So that degree, the students put in at least 600 hours to obtain that. I'm sure you remember that, them going through that, in addition to their undergrad studies that they did. So then they took on this other terminal degree in their profession, but they're all working, practicing FNPs, in addition to obtaining their DNPs. So it's a clinically based doctorate. It's different from a PhD, which is very research-based and also very tenuous, if not more, as far as hours are put in. But here they're working and obtaining their DNP educational degree as well. And it was really quite a feat. You should all be so proud of yourselves. Really. I got to know them again in 2019 before the pandemic, and then we all went on Zoom. But I really feel like we had a lot of personal conversations about our beliefs and about supporting each other and what we went through. I mean, we've had sick parents, sick grandchildren, children that were not able to be in school, that were having, stress issues with that. And we all tried to support one another to really get you through to this day where you are today. So not only are you my colleagues, but I feel like you're my friends. So you're not going away, and you have to promise myself and Dr. Ahern and Dean Tucker that you will take all this research that you did. We're so proud of you, and continue and get all this information out there, whether it be on YouTube, whether we connect you to community partners to keep going, but you have to do that, please. You promise? Okay. I want to really thank 2 women that have a lot to do with getting them also today on the stage, and that is really Lynn Tyson, who is our graduate, and Kathy Sheehan, our administrator in the nursing department. These ladies work tirelessly for every student, but really particularly make sure the DNP students are, on track to be where they are, and just the communication that we all have together, and the students understand that they really deserve a round of applause. Amazing women. And there's one more person I'd like to thank. To me, she's our cheerleader in the nursing department. She's always comes to every event that she can and supports the students, and she knows many of these students from their undergrad studies here in Wagner College. And the students that she didn't know, she was still excited to come tonight and congratulate you, and that is Dr. Peggy Turgeson. She So I would really, also just one more, I would like to thank Dr. Kathleen Ahern. Without her support to these students and tireless hours in each one of you that she invested, I'm not sure we would all be here today, and that's how, no, right? I mean, so please, Dr. Ahern is unreal, really the backbone of this whole nursing department and program. I'd like to just close to wish you all a blessed holiday and a happy and healthy new year, and I wish you to celebrate your success, whether it be tonight or in the next few days coming, and you all deserve it. And we were supposed to have a completion celebratory dinner tomorrow, but unfortunately we had to cancel due to the ongoing and increasing cases of new COVID cases on the island. So I promise you we are going to do it. Vanessa, probably the babies will be born already at that point. We'll have to sign your husband to babysit for a few hours while you come to the dinner. And then we will definitely are going to meet and celebrate this success, but I think it's just to be safe. We wait for a couple of months until this wave dips again, and then we are definitely, okay? All right. Good night, everyone.